Patients using the hospital feel it has been reduced to offering clinic services only. For extensive healthcare services, they now travel to the next closest hospital, about 45 kilometers away. It's alleged that nurses are deployed to departments they are not qualified for. A retired nurse who worked at the hospital says the deployment of nurses in this manner is nothing new.
For me, as a professional nurse that's not qualified as an ophthalmology nurse, I would say they misuse me like that. Because really, for me to work there was a challenge. But I took that challenge. And as I was working I was a casualty sister actually. But the situation that time was much better.
The community is calling on government to intervene in what they see as a lost situation.
Oh, it's so disappointing to notice the state of Grey Hospital. Long ago, or back in the day, it was the hospital. We knew when we went there that you will regain life. But now, our hope is dying because we see our families that if you go there, rather than going there, you should choose to go to the mortuary because there is no hope. There is no staff, there are no medication. I mean, the condition of the hospital is that itself doesn't bring any hope to us.
One being the shortages of staff, medicines, and ambulances, emergency vehicles. Secondly, it was a concern as to the allegations that a lot, if not most people, have had close people, relatives, that have passed on, and they somehow directly blame the hospital for negligence for such. Also, there is a third thing, which is basically the hospital. It doesn't look as the place where, people who've got health issues should be. I mean, it's clear evidence that there are birds on the trees pooping all over. There's a strong smell coming inside, from those trees.
The Department of Health says the staffing issue is linked to funding constraints.
The challenges of Grey are not unique. They are challenges that cut across in the province because as the province, we've been unable to employ the people that are called non-clinical staff. That is your workers, your porters, because of the budget constraint. I think in the past 2 years, we've been only employing doctors and nurses. That's one of the issues that have been raised by the staff of Grey, that there's a shortage in the non-clinical. But I said in this financial year that is going to start from March, we are seeing to it that with the legal budget that we have, we must prioritize. I will engage Premier's office, I will engage Treasurer to say.
Disgruntled patients and their families have been using social media to vent their frustrations about the situation at Grey Hospital. Sidima Mvegu, SABC News.